Good afternoon and welcome to the coronavirus press conference from Downing Street. I'm joined this evening by Steve Powis, the National Medical Director of NHS England. Steve will provide an update on the latest data on coronavirus shortly. But first, let me update you on the steps we're taking to defeat it and the decisions that we've taken today. Our fight against this virus is happening all across the country, in every home and in every community. Today's data shows that 460,437 tests for coronavirus have now been carried out across Great Britain, including 21,389 tests carried out yesterday. 114,217 people have tested positive. That's an increase of 5,526 cases since yesterday. 17,759 people are currently in hospital with coronavirus in Great Britain, down from 18,711 yesterday. And sadly, of those hospitalised with the virus, 15,464 have now died. That's an increase of 888 fatalities since yesterday. These are heartbreaking losses for every family affected. Every part of our government, from Whitehall to your local town hall, is working together in this national effort. And nowhere is that clearer than on the front lines of our communities. And today, as Communities Secretary, I want to provide an update. Councils are delivering essential supplies to clinically vulnerable people, those that we have asked to shield themselves. They're paying out financial relief to businesses to enable their local economies to weather the storm as much as is possible. They're ensuring our bins continue to be collected. They're ensuring that schools remain open for the children of key workers, and that vulnerable families are kept in regular contact. And they're helping rough sleepers off the streets to protect them from the virus. This effort, alongside the endeavours of all our public servants, is making a difference in this fight. But I know it is our responsibility in government to make sure that those frontline workers have the resources that they need to keep up this essential work. At the beginning of this emergency, I told local councils that we would give them the resources that they need to do the job, and I meant it. And that's why today I'm providing an additional £1.6 billion of new funding to support councils with the pressures that they face as they respond to COVID-19. This funding takes the total amount given to councils to help them through the pandemic to over £3.2 billion. We are backing councils to ensure vital services such as adult social care, children's services, support for the most vulnerable, and waste collection continue despite the increased pressures. We're also helping councils with the inevitable cash flow challenges by deferring £2.6 billion in business rates payments to central government and paying them £850 million in social care grants upfront this month. Working with councils and charities, we've made huge progress in protecting the most vulnerable during this national emergency. Our plan to shield the most clinically vulnerable people has progressed well. 3 weeks ago, I reported at this press conference that the first government-organised boxes of supplies had been delivered by wholesalers to those at the highest clinical risk across the country. Today, 250,000 have been delivered. The packages include cereal, fruit, tinned goods, tea bags, biscuits, toiletries, and other essentials. And this coming week, we expect to be delivering 300,000 boxes, all from a standing start just a few weeks ago. And our call centre is making up to 130,000 calls a day to those who are shielded, to see if they need the service, to see if they still need it if they're receiving it, and to ask if they would like to move from it to a priority delivery slot at their local supermarket. In addition to this, councils are organising their own calls, often led by volunteers, including from our 750,000 NHS volunteers, to check in and to chat to those people who are being shielded. They've also organised their own efforts to support those who may not have one of the clinical conditions to be shielded, but nonetheless, people who are vulnerable or isolated. And there are truly extraordinary efforts underway in this regard, in every village, in every parish, in every town, ward, estate, and city, the length and breadth of the country. We've all been humbled by the gestures, large and small, by people across the country to show support to those working so hard to protect the NHS and to save lives. None more so than Captain Tom Moore, who has raised an astonishing £23 million this week for NHS charities. I can't think of a more worthy person to be the guest of honour at the opening of the new Nightingale Hospital in Harrogate next week. Also, fittingly, the county of his birth, Yorkshire. I'm sure that everyone will want to join me in thanking Captain Tom for his truly heroic efforts. I've also been very proud of the effort of councils to help vulnerable people in their own areas, including securing safe accommodation for rough sleepers. And our plan to protect rough sleepers has resulted in over 90% being offered safe accommodation. I want to thank all of those who've helped to make this possible, including local councils, charities, and other organisations, and those continuing to help the small number of people still, regrettably, on our streets today. Of course, this is not the end of rough sleeping. There is still a great deal of work to be done, and my department and I will be at the heart of that. I also want to say something about support for our high streets and local businesses by local councils. I'm delighted that so many cafes and restaurants and other businesses have taken up the opportunity to switch to offering delivery, takeaway, and click and collect services. This expands the supply of food available to people alongside the supermarkets, as well as allowing businesses that would otherwise have closed to remain open and to keep paying their staff. This simple freedom has been taken up by enterprising people across the UK. The same enterprising people whose ingenuity, sometimes assisted by government in modest ways like this, will help us to rebuild our economy. Councils have worked extremely hard to pay out over £1 billion worth of business grants from government. But it's vital that we all ensure that every eligible business gets the support it needs. And I would urge councils to keep up the good work, and those that have been slower in making progress to accelerate their efforts in the days to come. Let me address two other topics that I know are of concern to local people. Firstly, there have been examples of some parks around the country closing. This cannot be right. While the virus does not discriminate, we know that the lockdown is much harder for people who don't have a lot of living space, for people who don't have a garden, and for those who don't have anywhere for their children to run around. People need parks. That's why I've made it clear to councils that all parks must remain open. For the health of the nation, people should be able to enjoy safely fresh air and green space. And for the health of the nation, people must abide by social distancing rules and not congregate in groups in those parks. Secondly, there have been some reports of mourners being turned away at funerals. The tragedy of the death of Ismail Mohammed Abdul Wahab, a 13-year-old boy from Brixton, was compounded by the fact that his family were unable to attend his funeral. That is not right, and it shouldn't have happened. For clarity, funerals can go ahead with close family present. Social distancing measures must be respected, but families must have the opportunity to say a respectful goodbye to those that they love. We'll be publishing more guidance on this very soon. And I'm also asking councils to keep open, or indeed to reopen, cemeteries and graveyards, not for people to congregate in, that must not happen, but for people to make that private visit, to seek solace in a word at the grave of someone that you've loved, or to privately lay flowers. There have been times in my life when I've needed to do that, and I'm certain that there are people who need to do it today. These are small steps, but small mercies can make a difference, and local councils, at their best, can help to make life, even in times like these, more livable and more humane. They represent and can harness the networks of familiarity, of trust, and of loyalty upon which society is based. The sense that we belong together and that we will stand by each other in a real emergency. Those relationships can only be built from below, by people, to people, in communities. So to all the unsung heroes of local councils, for all you're doing for all of us, thank you. I'll now ask Steve to present the latest data. Steve.
Thank you. Well, as we all know, it's only by complying with the instructions we have been given on social distancing, staying at home, avoiding contact with each other, that we will reduce the chance this virus has to spread from one person to another. And by doing that, we will see reductions in infections and reductions in hospital admissions and deaths. And I'm pleased to say that we continue to see evidence that all of us are complying with those instructions. Our transport chart that we show every day continues to show that on public transport, here National Rail and London bus and tube services, we are continuing to see a great reduction in usage and also in motor vehicle usage during the week, and of course a dip at weekends too. So that's really important, and of course it's absolutely critical that we continue to comply with those instructions and to do everything we can to stop the spread of the virus. In the next chart, we see the number of new infections and new UK cases by testing. Testing is expanding all the time, and we are seeing a stabilisation in the number of tests that are coming back positive. We're not seeing a growth, and of course in the context of an increasing number of tests. The next chart shows how that is translating into hospital admissions, and I think it is now becoming clear that we are beginning to see reductions in the number of people with COVID-19 in hospitals. You can see that in London, that we have now had a succession of days where those numbers are decreasing, but also some signs in other regions such as the Midlands. So encouraging, but still early. We are still in a situation where, in order to continue to see these declines, it is critical that we all comply with the social distancing measures that we have been instructed to take. And then finally, on the last slide, as we have often said, unfortunately, a reduction in the number of deaths will be the last thing that will change. But if we continue to comply with instructions, it will change. Here we are now presenting death data for hospitals. The hospital data comes rapidly. We can get that very quickly, and therefore it's right that that is published immediately. But we can also collect data on deaths in the community, and now you will see a second line with some lag on it, which we are working hard to decrease the lag, looking at deaths in all settings. Thank you.
Thank you very much, Steve. Well, we'll now come to questions, and the first question is from Rhianna Croxford from the BBC. Rhianna.
Hi, thank you, Secretary of State. The BBC understands that the government has asked Public Health England to start tracking coronavirus cases and deaths by ethnicity. Can you confirm this, and will this data be made publicly available so that further deaths can be prevented? And a question for Mr. Powis. There's been research now in the UK for 3 weeks suggesting that coronavirus is having a disproportionate impact on people from ethnic minority backgrounds. And we're seeing a similar trend on an international scale in the United States. What's your understanding so far of the potential risk factors for these communities, and what can you tell them?
Well, thank you, Rhiannon. A very important question. There does appear, as you say, to be a disproportionate impact of the virus upon BME communities in the UK. And we've also seen that in some other countries around the world as well. And it's for that reason that the Chief Medical Officer commissioned work from Public Health England to better understand this issue. There are a number of reasons for that have been posited, and it's right that we do thorough research swiftly so that we can better understand it and then take any action that is required. As Communities Secretary, I'm acutely aware of this challenge and have been working with different groups across the country, ensuring that the voices of BAME communities are heard and that we are taking steps to ease the anxiety that they may be feeling, as we are with other communities and faith groups across the UK. And of course we'll continue to do that. And if the work from Public Health England leads us to take any further steps, of course we'll do that to keep everybody safe in all communities. Steve.
Yes, this is something that I'm very concerned about, and I know the Chief Medical Officer is concerned about too. I know he has spoken about that. And I think it's absolutely right that he's asked Public Health England, and who have the expertise, they have the experts to look at this in detail and get a clear understanding of what might be accounting for increased risks and increased deaths in particular ethnic communities. So I think it's important that work is done as quickly as possible. It's also important that it's done properly so we come to the right conclusions and then we can offer the right support and the right advice. In NHS England, obviously we have a number of our staff come from those ethnic groups, and we are actively also looking ahead of that work, what we have to do to support and perhaps protect them specifically. So that is work that is actively being undertaken at the moment. But it's a very, very important question.
Thank you very much, Rhianna. The second question comes from Dan Hewitt from ITV. Dan.
Good afternoon. Secretary of State, given we are several weeks behind Italy, Spain and other countries, and we know the impact this virus has on health workers, how have we found ourselves in a situation where we are dangerously low on PPE, on personal protective equipment, doctors and nurses are being asked to use disposable PPE, asked to be used PPE that shouldn't be designed to be used several times. This is a global demand, we know, for PPE, but given we know that's not new, why hasn't the government had a plan B here, getting small, medium, larger manufacturers to produce PPE? Some say they want to, but they haven't been contacted by the government. And a question to both of you, do you accept the worries of NHS doctors and nurses we've spoken to today, that by downgrading your PPE guidelines, by not providing proper PPE, you are putting their lives at greater risk?
Well, thank you, Dan, for the question. Look, we're all, I think, across the country in awe of the work that people are doing on the front line, in the NHS, in social care, which is particularly important to me as the Secretary of State with responsibility for communities and local government, and in other settings as well. And nobody wants to see people having to go to work on the front line to do that work, concerned that they don't have the protective equipment that they need and deserve, or coming home from work worried about whether there will be equipment available to them tomorrow. We've got to do more to get the PPE that people need to the front line. This is an extremely challenging situation. As you say, there's massive global demand for the equipment. This is a global pandemic, but we are trying to do everything we can to get the equipment that we need. We're trying to source more internationally. That is difficult at times. There is a great deal of demand for it, and the security of that supply can prove very challenging. But we are making progress there. And in fact, today I can report that a very large consignment of PPE is due to arrive in the UK tomorrow from Turkey, which amounts to 84 tonnes of PPE, and will include, for example, 400,000 gowns. So a very significant additional shipment. But demand is also very high. We are working with British manufacturers to ensure that they can make a contribution. And you've heard of some of the more prominent ones like Burberry and Barbour, but there are many SMEs as well being involved in that. And my department is also involved in trying to ensure that the supplies that we have get out not just to the NHS, critical though that is, but also to social care, often to smaller establishments like care homes all across the country. There's over 50,000 healthcare settings like that in the country, and we're using local resilience forums backed by almost 200 military planners to do the logistical task of taking the stocks that we do have and getting them to the front line. But I completely accept that this is extremely challenging. Supply in some areas, particularly gowns and certain types of masks and aprons, is in short supply at the moment, and that must be an extremely anxious time for people working on the front line. But they should be assured that we are doing everything we can to correct this issue and to get them the equipment that they need. Steve, do you want to say something about the guidance that was published yesterday?
So I'm a doctor. I've worked for many years on the front line, and I can absolutely assure you that for me and my clinical colleagues, this is very personal. These are my friends, these are my colleagues, these are some of my extended family. So I absolutely hear directly the concerns that clinicians have to ensure that they have the right PPE. A couple of weeks ago, Public Health England worked very hard with professional groups, professional colleagues such as the Academy of Medical Royal College, the Royal College of Nursing and others, to ensure that we had a set of guidance that was professionally agreed and was the best possible guidance for the stage of the epidemic we've reached, taking into account what we've learned for the virus. And in order to ensure that that guidance can be followed, it's absolutely critical, above everything else, that we have the supplies of PPE going out to the front line. I know government is working incredibly hard to get those that procurement in, as you have heard. But what I hear from my clinical colleagues is that what they need is PPE delivered to the front line to follow the guidance that was agreed with them 2 weeks ago.
Thank you. Does that answer your question, Dan, or would you like to ask a follow-up?
On the gowns, I think you said 400,000 being delivered in the next couple of... I mean, that only covers 3 days' worth of supply for the National Health Service. They use about 155,000 a day. So that's a small amount, given this is going to go on for several weeks and months. And I know you talked about SMEs being used to produce PPE, but that's not the message we're getting from business. There are many SMEs who have been asking the government and saying, yeah, we can help do this, and yet they've had absolutely nothing back. I mean, can you name some SMEs that the government has used in the past few weeks to try and get some of this stuff to the front line?
Well, we want to work with all manufacturers in the UK that are able to produce this. If there are businesses, particularly SMEs, who feel that they haven't been listened to, that their requests haven't been met with the correct answer, then I would please urge them to get back in contact with us. This is a huge national effort. As I say, we're working internationally as hard as we possibly can. Our missions around the world, in countries like China, for example, are doing everything they can to source the PPE that we need and bring it to the UK. Businesses here are playing their part as well. We've published extra guidance, such as the one that Steve has just spoken about now. But I don't underestimate the scale of the challenge. As you say, demand is extremely high, and quantities are in huge demand internationally. But we'll continue to work as hard as we possibly can. And those healthcare workers who are on the front line, again, should know that we completely understand their anxiety, and we're doing all we can to try to get them the equipment that they need as quickly as possible. Can I take the next question, please, from Deborah Haynes from Sky. Deborah.
Thank you very much. And if you'll excuse another question about PPE, please. This one I'd like to direct at Professor Powys. We've been speaking to someone who works in ICU at a major COVID trauma centre, and he's been describing to us supplies literally being on the brink of running out. Why is there such a national shortage? Is it a failure to stockpile in the first place? Is it a failure of the supply chain to buy and distribute efficiently? Or is it the fact that we have just put too much reliance on China for these sorts of imports? And a question for the Secretary of State, if I may, on a different subject. How come you are able to claim that your house in Herefordshire is your main home when your children go to school in London and your wife also works in London? Shouldn't you really apologise to people for seeming to have broken the rules there?
Well, shall I answer your second question first and then hand over to Steve? Well, as I explained at the time, I joined my family at our home in Herefordshire as soon as I was able to do so, as soon as we made the decision that it was no longer necessary to work in person in Westminster. And I've been there, like millions of people across the country, since I've been working from home. And I returned to Westminster last night to do this press conference, and because Parliament returns next week. And I also delivered some medicines to my parents who are elderly and are self-isolating. And again, that's entirely within the guidelines. And in fact, I wouldn't want people to feel concerned that they can't do something like that to help their own parents or elderly relatives who are in need. We all need to follow the social distancing guidelines. I try to do that, but I appreciate that it is challenging for many people and for many families, and that the lockdown doesn't affect everybody equally. And that's one of the reasons why this evening, for example, I've said how important parks are and how I'm using my role as Secretary of State in local government to make small adjustments that make the lockdown more bearable and more socially just for as long as it continues. Steve.
So I think on the broader issue of PPE, yes, the government does stockpile PPE for pandemics, and that has been incredibly important and useful in our response to this. But as you hinted at, this is a global crisis, a global emergency, and there is undoubtedly a strain on supply chains for PPE. As I said, the government and the Department of Health in particular are working very hard to secure that. You've heard about a shipment that's coming in tomorrow, but there is quite a strain on the global supply. What's important is that the government works as hard as possible, because as I said a few minutes ago, I know as a doctor that what is critical for those ICU colleagues is that we ensure that they get the appropriate supply of PPE. It does vary. You've heard about gowns, but face masks, the FFP3 face masks that are really important in ITU, I understand we do have a good supply and a good stock of now. So it is important that we continue to do that procurement and get that stock up, because that is what gives our staff confidence on the front line, as you've said.
Very good. Thank you very much. And the next question is from David Wooding of The Sun. Dave.
Good afternoon, Secretary of State. Question for both of you, really. Sir Patrick Vallance told the House of Commons Health Select Committee recently that each death from COVID-19 equates to approximately 1,000 cases. So given that 15,464 people have sadly died in UK hospitals so far, would it be a fair estimate that about 15 million people have so far been infected by the virus? And what does that mean for herd immunity? And if I may be permitted just to add a sneaky second one, reports in other countries show that outcomes for people who go onto ventilators early are much better. And this week, F1 gave approval to produce more. So how many are we producing, and how fast and how quickly will we see them in use in our hospitals?
Well, thanks very much, Dave. I mean, as I understand it, the comments that you're referring to were made by the Chief Scientific Advisor some time ago. This is obviously a very fast-moving situation, and we're learning more every day about the virus and gaining more data, and Steve perhaps is better placed to explain that. But more recently, Sir Patrick and others, I think, have advised us that the percentage of the population who have had the virus is likely to be significantly lower than what you've just described, perhaps in single figures. But Steve, you're better placed to explain that than I am.
Yes, if I remember correctly, he gave that figure a number of weeks ago at an earlier stage of the epidemic, and that would have been based on modelling data and information that we had about infection rates in other countries and hospitalizations, for instance. I think what's important now, as we're a few weeks further on, is actually getting the real number as to infections in the community, and that is best done by testing antibodies, i.e. testing people who have developed or caught the virus and then developed an immune response and have got antibodies in their blood. We're beginning to see some studies from other countries that are doing that. It's not straightforward, firstly because the tests are still being worked out and we don't have the perfect test for antibodies yet. Secondly, we don't know how many people produce antibodies when they've had the virus and when they produce it and how long those antibodies last for. But that's the important information that will give us an actual figure, which is much more closer to the actual number of infections. That work, as Sir Patrick has said, is ongoing in the UK at the moment, so we can have that information for the UK rather than relying on other countries. It will be a very important piece of information in terms of plotting our way forward and planning for the next few months. But I think, as I've said, that is I think rather than going back to what was said a few weeks ago when we were in the early stages, what's important is to get an actual handle on the number using the techniques that I've just described.
Great, and you also asked about ventilators. As of today, there are 10,606 ventilators within the NHS. As I understand it, 190 of those have come from the new UK suppliers who rose to the challenge that the Prime Minister and the Health Secretary set to British industry to use all of their ingenuity and engineering skills to turn their attention to this task. I think the most important point, and Steve may wish to add to this, the most important point to say is that there is sufficient capacity today in the NHS. There are sufficient ventilators, and although you can never exactly predict the future trajectory of the virus, we're increasingly confident that there will be sufficient ventilator capacity in the NHS in the weeks and months ahead, which is obviously hugely reassuring to all of us, because just a few weeks ago that was one of our great concerns. Would we have that capacity? It seems like we have, and of course there are more ventilators coming on board from those UK suppliers and internationally as well in the days ahead.
Yes, so I don't think we are not constrained by ventilators at present, and we've in the NHS constantly striven to make sure that we have the capacity to manage the surge in patients that we've seen, and I'm really proud that our staff have done that. I think on the broader point, as you would expect with a new disease, a new virus, our clinicians are learning about the management of patients all the time. We have some of the best critical care doctors and clinicians in the world in this country, some of the best chest, respiratory, lung physicians in the world, and I'm absolutely confident they will be giving all patients the best possible care. But we are learning which particular sort of ventilation, which particular mode of ventilation works the best. So one example that you will have seen is it's not always necessary to put people onto ventilation where they need to be intubated, have a tube and go on a mechanical ventilator, although that is absolutely necessary in many cases. Sometimes you can manage the problem with the oxygen in the lungs through a tight-fitting mask, so-called CPAP, continuous pressure airways ventilation. And we are learning all the time who might be more suitable for that and who might be suitable for other forms of treatment. That's an international effort. So I've doctor for many years. In my specialty, kidney disease, I spent a lot of time talking to my colleagues around the world, learning from them, and they would learn from us. That's how medicine works. You learn through international collaboration. So I'm absolutely confident that our critical care clinicians, in fact I know they are not only talking amongst themselves and discussing what they're learning, but are also talking with their colleagues around the world. And that will continue to evolve. We will continue to learn more about the optimum treatment and management for patients with COVID-19.
Does that answer your question, Dave?
Yes, thank you. Very detailed. Thank you.
Brilliant. Thank you very much. And the next question comes from David Maddox of The Express. David.
Good afternoon. Secretary of State, first of all, is there an update on the Prime Minister's health? Has he been able to speak to any ministers in the last week since he was released from hospital? Looking also at the graphs that you presented today, a question to both of you really, there's obviously a significant reduction, particularly in London, on hospital admissions. We've had a series of big announcements on vaccines, PPE and testing. Are we finally on the front foot in the battle against this virus, or are we still running to catch up? And finally, sorry, if I may, one quick other one. When we do come to loosening the lockdown, obviously people are going to be feeling quite nervous and there's going to be a great deal of anxiety still about going out. Is there any thought on how people can be given confidence that it will be safe?
Thank you. Well, as regards the Prime Minister, as you know, he's resting and recuperating at Chequers. He's taking his doctor's advice. He has had some contact with ministers, but mostly with his private office here at Downing Street, and that's absolutely right. I mean, we all wish him well and hope that he takes the time to get better as quickly as he possibly can. In the interim, the First Secretary, Dominic Raab, the Foreign Secretary, is leading. He's chairing the cabinet meetings and the other important COVID response meetings that are happening every day. And with us as a cabinet, taking important decisions. For example, as you say, the decision this week to extend the lockdown measures for a further 3 weeks. And so that's absolutely right. As regards to where we are, I mean, I'll let Steve talk to the numbers as he sees them, but it is absolutely correct that the hard work, the forbearance, the fortitude of the British public is paying off. The rates of transmission in the community are falling, and there's a number of positive indicators which give us cause for hope and to believe that there is light at the end of the tunnel. But nonetheless, the number of deaths that I've announced today remains extremely sobering, and more of us, I think, across the country know somebody who has been unwell. More of our lives have been touched by this virus as every day goes by, and I think that just reinforces to us all the need to consider this moment as the one to keep going. Don't lose what's been hard won over the last few weeks. Keep adhering to the measures, keep respecting the advice from the clinicians. And if we do that together as a society, then in the weeks to come, there may be opportunities to begin very cautiously to ease the lockdown measures. But that day is not today, as the First Secretary said just a few days ago. Steve.
Yeah, so it is encouraging, as you pointed out, that we are beginning to see a reduction in the number of people who are hospitalised with COVID-19, and London, as I said, and as you pointed out, is where we are beginning to see it earliest. But that's only happening, as I also said, because all of us are complying with the social distancing instructions. And if we have begun to get on the front foot in complying with those instructions, I think what's absolutely critical, as the Secretary of State has said, is to ensure that we don't go onto the back foot and we don't lose all the benefit that has been gained, because this is not something that is going to be dealt with in a matter of weeks. This is something that will require getting onto the front foot and remaining on the front foot for a good period of time. And so what's absolutely critical, though we are encouraged and though there is evidence that following the instructions, following the social distancing guidance is beginning to result in benefit, we absolutely need to keep that up. This is not the time to rest on our laurels, to think that we've got on the front foot and therefore we have to stop complying with instructions. We need to continue to keep getting onto the front foot. I don't think we're there yet.
Thank you. And as regards your question about whether people should be concerned about a future easing of the measures whenever that is the right time to be deployed, well, a great deal of work is going on within government to consider how one might do that. Steve and his colleagues within the NHS are experts at SAGE, and others are working with us across government to prepare to see what's happening in other countries and what are the best steps that we could take in the future. But as Steve says, that moment isn't today, and the present situation remains finely balanced. And we don't want to waste the hard work and sacrifice that's happened in recent weeks. So the message very much to everybody watching at home today is continue to pay heed to the advice, continue to follow our message, which is to stay at home, to protect the NHS and to save lives. If we do that, then we can look forward to loosening and a gradual return to normality in the weeks and months ahead. The last question I have today is from Vic Matuna, who is from The Voice. Vic.
Secretary of State, many thanks. I'd like to ask two questions, if I may. The first I'd like to address to Mr. Powis, and then the second to yourself. Mr. Powis, in your answer earlier, confirming the fact that there will be a formal inquiry into the fact that COVID-19 seems to be having such a disproportionate effect from people from Black and minority ethnic communities, you mentioned that there would be a number of experts who will be involved in that inquiry. Could you tell us or give us any indication of who those experts might be, if there's a timeline for the inquiry, or what the scope will be? The second question I'd like to address to you, Secretary of State. There appear to be some concerns expressed over the last few weeks about the fact that the hostile immigration policy that was such a big part of the Windrush scandal is curbing the government's ability to spread curbing the government's ability to really stop the spread of the pandemic. we've seen in the last few weeks that there have been a number of really tragic cases of undocumented migrants who have developed coronavirus symptoms, have passed those symptoms on to members of their families, and in many cases have been too afraid to seek medical help, either because they may be deported, they may lose a job, they may even have their families evicted from wherever they're living. One of the real kind of concerns about this has been expressed by a number of MPs. I'm sure you may know that there has been a group of cross-party MPs who have written to the government, urging the government to drop NHS immigration checks and also drop charging of migrants for healthcare. So I wanted to ask, will the government heed that call?
Very good, thank you. Well, first, as I said in answer to an earlier question, we're very concerned about the apparently disproportionate impact of the virus upon BAME communities and certain ethnic minorities, and it's right that the review that's been commissioned by the Chief Medical Officer happens as swiftly as possible. Clearly, it needs to take the best possible advice and gather the right data so that it comes to the most accurate conclusions to inform how we continue to treat people and to manage the virus in the months ahead, because the virus in one form or another will be with us for a long time until there's a vaccine at least. And I'll allow Steve to say some more if he has it on how that review will be done. We're acutely aware of the anxiety within certain communities. As Community Secretary, that's extremely important to me, and that's why we're trying to reach out to all communities for their concerns as we formulate policy, for example, faith groups, as we consider some of the arrangements that I described earlier in my opening remarks about how we treat people's funerals and the way that families can mourn for individuals that they've lost. I have heard a number of representations about those people who do not currently have recourse to public funds, who've come in an undocumented way from other countries. The government's policy on that hasn't changed, but there is the ability for local councils to make sensible decisions based on the risk to life that there may be in a small number of cases. And that's, for example, the way that I know many councils regularly treat real concerns, for example, with rough sleepers in winter, and it's the way that those councils would approach this situation as well. As regards to the broader question about the NHS and the very large number of people who come from all over the world to work within it and to contribute, well, I think an emergency like this does remind us again of the incredibly important contribution that they make to the NHS, to social care, and to our broader society. That's why steps like the NHS visa, for example, are very important, so that we can help people who want to come to the UK, who want to work in those services, to come here, to play their part, and to feel honoured and appreciated by our society for the contribution that they're making. Steve.
Yes, so as I said earlier, and as you've just heard, the Chief Medical Officer has commissioned this review from Public Health England. Public Health England do have experts within that organisation who are in this area, but I'm sure the Chief Medical Officer will also want to ensure that other expertise is drawn in from other academic groups or other areas that have expertise too. I can't give you the names, I'm afraid, but I do know that the Chief Medical Officer is working on that with the Medical Director of Public Health England, Professor Yvonne Doyle, who was on this podium yesterday. And I do know that he wants this to be done as quickly as possible, but also to be done rigorously to ensure that it is done appropriately, the right answers, the right conclusions are drawn, and it's the correct experts and the right experts who are able to look at this.
Very good. Thank you. Thank you very much for your question. Well, that concludes this evening's press conference. Thank you very much indeed for listening.